totally understandable when someone comes in and says treatment doesn't work for me, given that the national recovery rates for most patients is less than 15%. That's characteristic of being treated with the 1930 philosophy and what we believe has created the addiction. For sure, our current approaches are evolving from a moralistic point of view where patients were seen as sinful or bad as a result of having an addiction, which was characteristic of the climate in the 1930s. We now know that neurobiologically there have been structural and functional changes in the brain that are characterized by increasing compulsions and cravings to use a substance that are beyond a patient's control. So if we use old-time treatment to treat basically a new-time understanding of what's going on with a patient, the outcomes are not going to be particularly good. In my opinion, the most effective treatment outcomes are going to be achieved by engaging in a patient through an extended period of time. Obviously, 30 days of treatment doesn't do much other than isolate a patient from the use of a particular substance for 30 days. Perhaps a more effective treatment strategy would be have people engage in treatment over a 2-year period of time, because if we look at the definition of structural changes in the brain, there aren't many structural changes that we're going to remedy in 30 days. So you have to be in a position where we, if you will, reboot the brain such that people develop effective coping strategies, learn to handle stress, and engage in behavioral changes so that the neurobiology of the brain has subsequently changed where people regain some type of control. So I think an extended period of time in treatment is by far most effective treatment strategy, and this should occur on an outpatient basis, because the substance occurs in the real life setting where people live, and you have to be able to treat and confront the issues on a daily basis in order to get better and learn to live with your addiction.